All right, let's look at the cranial nerves. So again, we're not going to see the olfactory nerve because it's just the branches, the axons of the actual sensory cells. The optic nerve, you could, if you wanted to, you can kind of push the eye aside. You might be able to see it underneath there, but we'll take a look at it later on when we pull the brain out. Number 3, the oculomotor is a large nerve that goes to most of the extrinsic eye muscles, and it's sitting right there, that kind of white, yellowish line. Number 4 is the trochlear nerve right there, and it's just going up to the superior oblique muscle. And then this back here is the lateral rectus muscle, and the abducens is hard to see, but it lies alongside of that lateral rectus muscle. All right, we skipped 5 because 5, 7, and 8 all come out together here. And it can be difficult to actually separate out which is which, but 5 is the more anterior portion, then 7, and then 8 we're not really seeing too well, but it's a smaller one. It goes into here, which is where the ear is, and we can see some of the branches here. Basically, it branches, one branch over into this direction, one branch into this direction, and then they immediately arborize out and become a bunch of single branches. That's number 8. All right, the trigeminal nerve has a whole bunch of branches that we can actually take a look at. So we've already looked at the superficial ophthalmic there and the deep ophthalmic, which is running on the eye here. Then another one is the mandibular branch, which can be hard to find back here, especially one-handed. But it lies right there. You actually can see it, white line, is the mandibular branch. Now, if we pull the eye up, we look underneath it here, what we're going to see is a large nerve down there. See that? Large nerve right there. That's the infraorbital trunk. And it actually has branches of both the trigeminal and facial in it. And so what we have going out the front here is the maxillary branch of the trigeminal, that larger one right there, and then this part, the smaller one right behind it, is the buccal branch of the facial. All right, so the facial nerve also contributes to the superficial ophthalmic nerve. We just talked about that buccal branch down there. That's that one diving more laterally, whereas, again, the maxillary branch of the trigeminal is going forward. What else we got? The high mandibular branch we looked at before. It's the one that's back here, right behind the spiracle. And obviously that's not where it starts. You can actually follow it all the way back into the brain if you wanted to. All right, the auditory nerve. The text calls it the statoacoustic, but again, that's one that nerve that goes by many different names, but we call it just the auditory to be simple. But it's within the ear cavity there. All right, number 9, we can see on this side is the glossopharyngeal. It's coming back right there. And in number 10, didn't really dissect it out very far, but there's a very large nerve right there. Oops, let's get the tissue out of the way. They can see it right there. That's the vagus nerve, and it goes back through the rest of the body.